Do you ever consider your mental health issues as extensively as your physical health issues? Does mental health problems slightly matter to you? If you believe so, therefore you might need to change your mentality. A total of 424,000 children in Malaysia have been reported to suffer from mental health problems, while as many as a quarter of Malaysian adults experience functional difficulties, according to the National Health and Morbidity Survey (NHMS) in 2019. Nearly 1 in 10 children aged between 10 and 15 years have mental health issues. Even the young children may show early warning signs of mental health concerns. Mental health conditions or mental illnesses are recorded to become the second biggest illness after heart disease. So, what makes mental health conditions or mental illnesses are recorded to become the second biggest illness after heart disease? Let's move on. The graph shows that the reason why Malaysian people do not seek help when they have experience in mental health issues. The survey was carried by the International Survey Agency on 1,027 respondents in Malaysia. Mental health issues were not a common topic and have less exposure to the public. The study reveals that the main barrier in seeking professional help is the respondents being unsure of where to get help. Besides, half of the respondents state that they were concerned about the cost. This is because the cost of the treatment are very expensive. 38% of the respondents were concerned about the embarrassment and social stigma, while a quarter of Malaysian adults response were concerned about the time commitment. 14% of them have other reasons and 7% of them do not know why they do not seek help. Now that you have already know the reasons, let's look at the consequence that links to the mental health issues problem. The graphic charts are from the National Health and Morbidity Survey (NHMS) 2019. The graphic charts explain the type of difficulties and who is at stake. In addition to that, 4.7% of children aged between 2 and 17 years also reportedly suffer from functional difficulties. As we all know, 1 in 4 adults in Malaysia suffer from functional difficulties because of mental health problems. They suffer from difficulty in seeing at 14.9%. and making the type of functional difficulties at the highest, while 2% of them suffer from difficulty in communicating, making the types of functional difficulty at the lowest factor. Next, follow with the difficulty in hearing at 7.6%, difficulty with memory at 7%, walking difficulties at 10.4%, and troubles with self-care at 2.1%. As for the statistic of those at stake of experiencing functional difficulties, the urban population was reported to be lower at stake than the rural population, at 25% compared to the 34.4%. While women or females were reported to suffer from functional difficulties more than men, at 31.6%, which male counterparts reported at 22.9%. Because of mental health issues, the majority of functional difficulties was also reported to rise with age on a gradual scale, with half of those aged 60 to 69 suffering such problems, rising to 65.5% in the 70 to 79 age group. 91% majority among those aged 80 years and above. The reason most of the Malaysians who experience mental health issues do not know where to seek help, eventually getting them worse, and makes the health problems to become the second biggest problem in Malaysia. Mental health conditions or mental illnesses need to be taken seriously starting now. Society who encounter mental health issues need special support and guide for them to get better. The mentality of Malaysian society about mental health needs to improve to avoid the social stigma on the patient or people who have the difficulties to seek help. Malaysian society needs to be more knowledgeable about mental health issues because they will eventually help the person in need and also themselves. We can make a difference by spreading awareness about mental health conditions or mental illnesses to society.